koutou, it's Bruce here. I'm a public health nurse at the moment in Wanganui, and just looking at the career pathway that I'd like to be on for a future nursing career plan. I started in 1991 with up in Auckland at the AUT, Polytech at the time up there. Did my 3 years there in 1993, finished that in 94, started at Lake Alice in Wanganui, which was an interesting place to begin. I managed there for about 3 or 4 months, and then was involved in a bit of an incident which didn't go too well, and so moved into medical from there. I was in medical for about 18 months, which was a great grounding for nursing and hands-on, and really appreciated some of the practical stuff I learned, especially from enrolled nurses, which was cool. I particularly didn't like my little things that you had on your shoulders, so I took them off because I just thought the hierarchy thing was all a bit interesting. So, and because from the enrolled nurses I actually learnt a lot from them, so that was a great place to start in medical ward. I then went to Children's Ward, wanted to work with kids, and I worked there for about 3 years before going back to Auckland to finish in 1997. I went back to Auckland and finished my degree off. I had to do 3 papers to bridge it from the diploma to the degree, so I did that, which was great actually, and I'm really pleased I did that. Then I started working about 1999 in public health, and I've been there ever since. So about 15 years in public health. I enjoy the public health thing of prevention, which is a really key part of public health nursing. It's really hard, like smoking stats and stuff like that, and even if I see people smoking down the street, I'm very tempted to pop give them a quit pack or something. I'll, bang them on the shoulder and say, hey, if you've thought about quitting, here's a 5-day, 7-day quit pack that you could try. So I think prevention is a key to where we are in public health, and whether it be family violence, obesity is another thing that is just taking the land by storm, and it's working out how can we address this, how can we get some practical tools in for whānau about eating sensibly, eating for health, and not just eating for pleasure, I guess, eating because we need to. And so it's interesting to look through some of those things through their eyes as well, not just my eyes, but also how can we support families to improve their health around eating smoke-free, alcohol and drug, smoking, stuff like that. From here, when I was 20, before entering nursing, I actually went to the Philippines and worked over there, and funnily enough I ended up on a smoky mountain, which is a dump really, where people come from Manila and dump all their rubbish, and I stayed in there for 3 or 4 days probably, just working there amongst the people, going around visiting quite a few people with one of the doctors there, checking immunisation status and things like that, just checking on children's health and that, and it was just a real eye-opener as to how some people live and how lucky we are in New Zealand, which was real cool. I worked with some nurses there, immunising, which was blew me away, because the house that they were was just portable, so it was all walls, roof. Basically, if the bulldozers came along, they could pull it apart, take it away. So that was amazing. And now I work in immunisation, which is quite cool. I didn't realise back then, the chili bins they had, the stuff they would have had to keep the cold chain, that sort of thing was just part of a team. And yeah, some nurses there that really inspired me to take up nursing. So that was when I was about age 20, and at age 24 I started my nursing career. So I started with the rubbish dump experience in the third world, and I'd like to end up back there. I'm married to a lovely lady with 3 kids at the moment, and last year we went to Cambodia and Vietnam, and we helped in a village make some houses, which was really cool. Basically like big tree huts, and you put them together, and the kids helped nail down planks, we helped put the sides on. It's pretty dodgy, was non-OSH approved, but it was a lot of fun, and we survived and got to know the local peoples in a real way. And I like the concept of a lot of these aid agencies that look at how they can give families a help up, not a handout. And so this one, they actually had to save up $200 US for the houses, which takes them 2 years to do. So it's quite a huge project, and a huge commitment on the families. But once they have that $200, which takes them about 2 years, then that's their own house. So they have a lot of ownership in the house, and they help you build the houses, which is cool. The actual products for the house cost $1,200, and we and our church actually put some money towards 2 houses, so that was neat. So we as a whānau provide 1, and the church provided one, and the rest of the team provided the other 6, so we built 8 houses, which was really neat. So I'm interested in that, and I'm interested probably in my career pathway as to how to get back there. I realise that I'm working in prevention now, and public health is a cool place to get some ideas for working in communities, especially sanitation, clean water, sewage, stuff like that, clean eating, healthy crops and stuff like that. So it's a good place to be, but I'm wondering whether I might need some more clinical knowledge to go back. Some of the hospitals over there was great. Just had a look at one in Cambodia that had been started by a paediatrician from Japan who saw a 12-year-old girl die before his eyes, and he was like, this sucks, really, this is not cool. So he took some photos in Cambodia, sold the photos, raised awareness, and now there's a cool, huge children's hospital in Cambodia, and Sam Reap, and we visited the hospital, and it'd be really neat to maybe go back there and be part of that, be part of an outreach team, something like that. So that's where I'm thinking of going. I'm in middle management at the moment, which has lots of challenges with my people, but the good thing of it is that you can help shape policy and stuff like that, and help look at practicalities, what we need on the floor to do our jobs better. I also work in a school, and I have a TB client, not TB, sorry, a rheumatic fever client that I assist with a monthly injection. So I do have a little bit of hands-on work, which is good, and I've also been recently involved in a mental health campaign, which was very interesting, working with lots of iwi groups in that, and I'm looking forward to next year's session on health promotion, because I really want to get a handle on how we can know that we've made a difference. And after the week campaign, we had a great time, and lots of different groups came and benefited from it. But I like to ask the big questions of, did we really make a difference, and can we ensure that the money we spent in there made a difference? So I think this year I've been enjoyed. It's my first time with the group and with the other groups that work in removing barriers for mental health. But I want to just see and approach the group and say, hey, should we look at getting it evaluated, or how can we know that we have made a difference to reduce stigma and discrimination for mental health? So that's a little bit of where I want to go and what I'm doing at the moment, and thanks for listening.